Hi, Kevin.
Hi, Andy. Good to see you.
Great, good to see you. It's been a long time. Kevin, can you introduce yourself, please?
Sure. So I'm Kevin Brown. I'm the National Integrated Urgent Care Director for Care UK, and we provide service for the Suffolk and North East Essex CCGs in integrated urgent care. So that means 111, clinical advisory service, clinical assessment service, and also for general practice out of hours.
Thank you. I've got a few questions for you, 4 to be precise, and I'll ask you the first one. First one is this: so how are you looking after yourself, and how are you supporting your teams?
So in terms of myself, well, I guess in the early stages it was somewhat lack of sleep with what was happening in the pace of it. So getting beyond that point, what I have been doing, and I'm probably one of the few when I speak to colleagues, is I've managed to lose a bit of weight rather than put it on. So that's a good thing. So that's down to obviously we're doing a lot of travelling before, so reducing that, so cutting a few of those coffees and cakes out. I've been able to get my bike out and clean down, which I've not ridden for about 4 years, and going out and getting some good exercise on that, and just eating better generally. It's that's broadly what I've been able to do, and really it's it's just looking after myself in that way.
And what about your teams?
Yeah, the teams have been absolutely fantastic, and what I would say is, as well as what we're doing for them, I think it's what the community have done for our teams. We've had phenomenal responses locally from food, cakes, sandwiches, bagels, coffee, those sort of things that have been delivered into the staff with some lovely notes of appreciation for what people are doing. And interestingly, someone donated their wedding cake because they couldn't have their wedding, and that was donated for the staff, which was a wonderful and very much appreciated gesture. What else we're doing for our staff, of course, is the working environment, particularly in the 111 setting, has changed quite significantly in terms of call centres needing to get more people in at pace, and also the social distancing side of it. So like others, is we've had some of our staff who've been affected by COVID or have had to shield. So as well as trying to respond to the calls, we've also been trying to respond to our staff and support them. So we've managed to move a number of people to home working, which is new for call centres. That's worked very effectively and been well supported. To put arrangements around that, but one of the things we've had to look at is the mental health for staff. So when they're isolated from their normal environments, is how to support them. And one of the things we have been doing is putting team calls in, which are just more around a social, just bringing people together through one of these types of platforms, really, and getting different people just to have a chat and feel part of the work environment still. And the bit I didn't say as well, and I guess it is a challenge that I'll chuck out to some of my team shortly, is just around the mental health, is I've been nominated to do 25 press ups a day for 25 days for mental health and PTSD awareness. So I have my children to thank.
Oh, wow. Okay, so I wasn't expecting most of that. The community support is a lovely surprise. And you're the first person I've interviewed who says you've lost weight and got fitter, so that's really good news.
Yeah, I've got to keep it up.
Good luck with the press ups. My second question is this: so 111 was front and centre of the response to this pandemic. What challenges did this present?
So quite significant challenges, really. Is obviously we started some preparation, sort of, when the signs of these pressures were beginning to come. When the early signs of it were in China and beginning to signal here in January, really. So we started sort of bringing additional arrangements in place for that. But what we saw is, as demand started rising, our ability to answer those calls as quickly as possible, as we would normally do, became more challenged. And the peak, across our network, and I think this is reflected nationally too, between 3 and 4 times the normal amount of calls that are coming in. So we had to try and respond to that, as to try and have patients remain in contact with the 111 service rather than to go elsewhere. So one of the challenges that brought us was, how do we do that? How do we make sure that people are being answered as quickly as possible, and how do we keep those patients safe by maintaining contact with them, so that we can manage the risk, which we did very well. So that was probably our main challenge, really, was the demand, and at the same time is capacity, one needing to build it in response to it with the amount of training and the time it takes to do that, but also at the same time with a number of our staff being affected, being symptomatic or having to shield, family, etc. So all those things were fairly challenging for us. But what we did do is we recruited at pace, quite significantly at pace. We redeployed a number of our colleagues from across the business to simply phone patients back who we'd made contact with. We put features onto the call answering, which allow people who were symptomatic to be diverted down one line, and also other patients who had urgent needs down another line, so we could try and manage safety. And then what we were doing is ringing people back to check on their conditions while we wait for clinical advice on them, and that was a very effective safety strategy.
Thank you. That's pretty comprehensive, and I assume other system partners were assisting you at times as well.
Yeah, we worked across the system. I mean, fantastic leadership across Suffolk and North East Essex from Ed and from Richard in particular. So everyone was coming together about how can we share resources, who can do what to help that. So, everybody being much the same boat, so, quite unprecedented times.
Thank you. My third question is this: so how was 111, or how has 111 evolved through these challenges?
So I think what we can say is that those levels of challenges were quite unprecedented. So the need to be agile from a technical perspective to respond to those, and also from a resource perspective, were challenging. So we very rapidly changed our recruitment processes. What we also in the circumstances is the number of people. We had over 5,500 people applied to work in 111. That's across our entire network, which is a phenomenal response to advertising. But what we were able to do is put a temporary role in place, which allowed people to talk to and give advice to people who were seeking advice rather than being symptomatic, and to guide them to go to NHS 111 online, for example. So they were some of the challenges that we faced, and how we responded to those. Of course, with dental practices not operating, is we were getting many more calls, and how we accessed dental services through our clinical advisory service or clinical assessment service. They were areas. And of course, when it came to the home visiting side, of course that brought the challenge about how does a patient want a clinician in the house to manage the risk, and similarly, how does a clinician be protected? And certainly in those early days, that was quite challenging. And this is where this type of platform came in, where consultations were done through video links. So whilst we had it on a limited basis before, we've explored that and rolled that out quite significantly, and that's much more used. So where that's really benefited is patients can be seen and assessed as to whether they need a home visit or whether they can be given advice, etc. So that's one of the things that's evolved really from it. And similarly, where we operate within the region, some of the centres out of hours where patients would come, is we've got hot and cold zones. So it's almost an arrangement where you wait in your car and get called forward, go into a cold zone before you go to the warm zone. Then all the decontamination is taking place to keep the safety there. So lots of things like that we've done. But the system engagement, I think, has been phenomenal. All system partners have been talking to each other about how can everybody work together differently, to provide this response and to have patients at the centre. So, that's part of the evolution that we've seen and continues.
Yeah, and I've heard a lot about workforce challenges. It was interesting to hear how many applicants you received applications from, and the digital transformation has been very rapid, isn't it? So that's probably leads to my last question, which is about, what do you think we'll learn from this outbreak?
Well, it's a good question. I think we're all going through. What are those lessons learned? What if we have a second wave, or if we have a similar thing, what can we learn from it? But I think what has been really good in Suffolk North East Essex has been the leadership, I'd say, from Ed and Richard in particular, and pulling the whole system together. So we've got people. How can we share resources? Where historically, as you work in an organisation, but actually, how can you work in multiple organisations? And I think the 111 side of things is, what we have found from that is the number of people who have now gone online for advice and have come to 111 to to get their support has had a really positive impact in reducing the number of people who attend emergency departments, which we know are particularly busy and under pressure. And of course, there's challenges there about how do they keep distance in the departments going forward. So there's certainly, we think, some of the lessons learned about how can 111 with system partners sort of integrate differently, so that 111 is in effect a single point of contact. Or a second point of contact, obviously general practice first, sort of in the day, but elsewhere is it's become a source where people have gone to very readily, and particularly the advice and support online. The growth in people using that has been substantial. So I think they're probably the areas of learning that we've got, and are talking about how can we take those things that we experienced and take those forward to provide a better service for patients.
So Kevin, just one last point. As I understand it, 111 has an option 2 now, at least in our area, for people to call you around mental health concerns, and this has become obviously an increasing issue as a result of the pandemic. What can you say about the 111 option 2 service?
Yeah, I think it's a great evolution of the service, really. So mental health, I think we're all very aware it's an area that needs much more focus, and it's a very specialist area. So the principle being that when you dial 111 and you go through the call answering options, is you can press the option 2 on there, and it will route you through to specialist mental health support, and of course that's they are the best placed people to provide that support in a crisis. So that's a great service.
Kevin, thank you very much for your time. I really appreciate your thoughts on what we're all facing and it's in the future that we have. Thank you.
Randy, thank you.